The COVID-19 created a huge need for knowing how was the infection developing.
We have learned a lot during the ongoing COVID-19 pandemic. We have found several challenges having the same definition, calculation and format of the data related to COVID. So we have learned from all of this, and now we are trying to support all the member states in how we can be prepared for the next emergency and be all on the same page. So in this regard, in particular, one of our commitments is to strengthen health information systems and health data governance, because the data is there, but we need to ensure that we have a governance framework that is articulating how the data is collected, produced, and used for policy decision making.
So the European data space is a proposed regulation by the European Commission for the use and reuse of health data in Europe. So what really prompted it was really the fact that we noticed that health data was not being accessed as well as it should by individuals across Europe, by the Europeans. The same for doctors, didn't have access to data they need to provide the care. So when we talk about the European data space, we have to see this as a set of rules, obviously, what's in the regulations, but also other activities to support this access to data for use and reuse of health data. So it involves infrastructures, it involves standards, so it's really a complex framework to facilitate this access to data for use for healthcare, for research, for innovations, policy making, regulatory purposes, so really trying to make the most of data available in Europe.
When you digitalize a broken data process, in return, you're going to have a digitalized broken data process. And digitalization is not going to help in data quality. That is the reason we are always advising countries to first address all the challenges related to data and health information systems, and then look at the digitalization of these systems.